Richard, thank you so much for taking the time with me today to really get me up to speed on what you're building at Epicured.
Logan, it's always great to be with you.
So you're really taking the idea of food as medicine to a new level with this meal subscription service. So I want to hear all about it, but I want to start high level and talk about why has it been so hard to connect the dots in the past between food and our holistic health?
Yeah, I mean, food and nutrition is fundamental. I mean, Hippocrates, all the way back in the day, said, "Let food be thy medicine." And with all of these incredible medical advances that we should be proud of, we kind of forgot about nutrition a little bit in our care delivery system. And with the onset of chronic disease, you can't manage those without nutrition. So I think it's having its day again, and we're here to help with that.
You know, you can't walk into a hospital without seeing, food being provided by, fast food chains and just greasy food. There seems to be a mental disconnect fundamentally in our healthcare system. And I know you experienced that. I mean, what was your experience of that in the healthcare system?
Well, we all know that no one has enjoyed hospital food for decades, let alone what we served in the lobbies of our hospitals when I was over at Northwell. And our challenge was to find innovative solutions in the market, and none really existed at the time. And so my co-founder and I, Renee Cherkasian, set out to change that, and we built Epicured, where we can develop and deliver Michelin-starred medicine to people around the country. And that's really what we focus on at Epicured.
Is there a certain patient profile that really comes to mind when you think, food as medicine can really come in and be almost a cure for this type of person? So someone who kind of inspires you.
Yeah, for right now, what we started was with our digestive disorder community, and it's an often overlooked and in many ways orphaned community. Digestive disorders afflict nearly 25% of the U.S. population.
Really?
And our clients, our customers, are human beings who have to be patients every day of their lives. And with this community, every food choice they make 3+ times a day is riddled with doubt, fear, and pain. And our ability to alleviate that really, builds heart into what we do. And we really love our community and are so proud of what we can help people achieve every day.
Just to keep it concrete, what are some of the conditions that you're referring to?
Sure. So we focus on IBS, irritable bowel syndrome, Crohn's, colitis. We focus on small intestinal bacterial overgrowth, which is SIBO, exocrine pancreatic insufficiency, EPI. We're entirely gluten-free, so we help celiac patients and non-celiac gluten intolerant. And we're really proud that Good Housekeeping named us the best gluten-free service in the country in 2021, which was a big achievement for a healthcare company.
I think it's fair to say that a lot of these patient groups that you've just described have suffered in silence for a long time.
So true.
And really haven't been given tools, have something they have to deal with, in private, and yet it's debilitating. I have friends who have a couple of those conditions. Talk to me about what the standard of care was prior to Epicured.
Yeah, the mental health and the anxiety around this disorder is really overlooked, and I'll come back to that in a moment. The standard of care typically is that we couldn't intervene. There wasn't a pharmaceutical regimen, and there wasn't an intervention in a scoping or other procedure. So with all good intentions, our medical community kind of was at a loss, other than handing them a flyer on what they could or couldn't eat, and saying kind of good luck and God bless. And that just isn't good enough, right? And we found that our partners such as Mount Sinai and others came to us we developed an extra sensitive menu for IBD flare-ups with Mount Sinai, because they're really looking to innovate in new care delivery mechanisms. So they're frustrated with what they can't do, and they see Epicured as an ability to fix that frustration for themselves as care providers and for the patients themselves, obviously.
So in the old way, patient has ulcerative colitis, perhaps.
Yes.
See, they come in and a gastroenterologist. It feels like they don't have tools, and so what you're saying is they give them a pamphlet that says, eat this, don't eat this, and the person goes home and has to sort of,
suss it out themselves.
Suss it out. So Epicured, meal subscription program, sort of how does that fix that problem?
So right off the bat is diet complexity. So these flyers aren't intuitive, and almost like gluten-free is easy because you have to avoid gluten. But many of these other diets, you can eat blueberries, but you can't eat blackberries. Apples are horrible, honey's okay. Like, I'm making this up, but sure. Don't follow this. But the idea is it's not intuitive. You can't just label read, right? And you can't cook, you can't go out to dinner. And then that goes back to something we talked about before, is that they feel orphaned, because now our patients on average are having somewhere between 7 to 15 bowel movements a day, right? And that's an uncomfortable thing, A, to live through, and B, no one wants to talk about it at the dinner table. And if you're in a professional setting, how do you navigate, right? So 50% of our customers, their families don't even know they have the disorder, right? They're ashamed. So when we do our ethnographies and we work with them on their care journey, it's really a tough, stigmatized disease. A, we try to destigmatize, and then with our product, bring joy back to eating. Think about being afraid of food every day. It's fundamental to who we are as human beings. It's social, emotional, cultural, and when that's robbed from you, on top of all the physical and other mental aspects, that's a bad deal.
So to bring joy back to eating again, that means it's got to taste good. So how have you made sure that these, I think I read you do like low FODMAP diets. How do you, these different specialty diets, how do you make sure they're still tasty?
Yeah, well, it's critical that we do this really well, and so we were able to recruit one of the best chefs in the world to be our chief culinary officer, Danny Chavez-Bello. He was Boulet's R&D chef most recently for the Boulet Empire. Boulet recruited him from El Bulli in Spain, where he was at the #1 restaurant in the world doing their R&D. He's worked with Wegmans, and so he manages our Healing Foods facility, where we make everything from scratch with the best ingredients around the world, focused not just on human health, but planet and animal health as well, right? We gotta look at the bigger picture, it's all interconnected. So Danny brings these flavor profiles, and he's accepted the challenge, as he says, is like try to type an email with only half the keys, or try to paint a Rembrandt with only half the colors. And that's the challenge he's accepted on his team, and he's executed on it flawlessly.
I love it. So you're targeting these conditions like IBS and UC, but I'm guessing that's just the beginning. Kind of what's the future vision for Epicured?
Yeah, unfortunately, the biggest problem in our country in healthcare is chronic disease, and we know that you can't manage chronic disease out of an acute care setting. So why we started to deliver to the home was that we could get these meals in people's homes, but most importantly is our infrastructure now. We translate scientific research into these meals, and it's not going to stop, to your point, with digestive disorders. So we're looking and working with a variety of partners across the country to develop, say, a renal menu or a bariatrics menu pre and post surgery. And we want to make sure that our clinical partners around the country have a nutrition partner for when they discharge a patient or when they're trying to manage disease through one of these, either an app or a value-based program.
You hinted at this a second ago, but it sounds like you're also really working on the food the food development side. So talk to me about what this means in terms of innovations on how you bring those meal plans together.
Yeah, well, there are two things. So we look at, we've talked about therapeutic expansion. We started only in the Northeast, and now we ship to 48 states, but we really only focused east of the Mississippi. So we're going to be building new Healing Foods facilities around the country, in probably Nevada or California.
Remind me what a Healing Food facility is.
A Healing Foods facility is our custom kind of kitchen, where right now it's a 16,000 square foot facility with 70 beautiful human beings in it who translate and bring to life what Danny has created, and then we pick, pack, and ship that out to our customers. But now, Amazon Go, for instance, just selected us to be the premier heat and eat entree provider for all their Amazon Go stores.
Congratulations.
Thank you very much. We're super excited about it, and they're beginning to roll out more after the pandemic, because our patients can't just get it at home, right? They are at conferences, they're traveling. You need to have it grab and go. So we're building our wholesale division, which my co-founder Renee Cherkazian is leading right now, to build out. We actually just opened up a wellness bar in Miami last week at one of the beautiful high rises across the Sound here. And so right outside of the gym and in kind of the work from home lounge, right, that they have on the floors, you can now grab and go Epicured in an honesty market. So we want to make sure we're getting the food. It's access points to care in my mind, and not everyone can do a meal delivery subscription service. That's not what we are. It's just our way to get to the customer. So that's the first thing, and now hopefully, we've had a lot of good conversations here at the conferences where we're looking for enterprise partners, right? To integrate more deeply into their care pathways and prescriptions, either for SDOH initiatives, right, or for value-based care. So a lot of fun conversations there.
Awesome, Richard. Thank you so much for taking time with me. I'm so excited about where this is going. You're just at the beginning of this really explosive moment in food as medicine, and you're really leading the charge. So thank you for the work that you're doing.
Logan, thanks for having me. Always a pleasure.
All right.